Hi everyone, welcome back. Today we're talking about the role of fluoride in dental health. This video is not sponsored by any of those brands that I mentioned, and also this video contains chapters, so make sure that you go to the chapter appropriate to you. Fluoride is very important because it will react with the molecule in your structure, in the tooth structure, and make that tooth structure stronger and more resistant to caries. Most first world countries have fluoridated drinking water. So basically their tap water is fluoridated and it's very good for you. So if you're living in an area where there's no fluoridation in the water system, then you should consider speaking to your dentist about supplementation with fluoride, especially for your kids. You can also use a fluoride containing daily rinse, and this is especially for you guys who live in areas where there's no fluoridated tap water. It's not prescribed, it's over the counter, and it doesn't have a huge amount of fluoride, but it's a good protection to have because you're not getting that through the water. Now, the supplementation of fluoride is dependent on the age of your child. So make sure to speak to the dentist about it and the dosage that your kid might need. Children aged up to 3 years old should use only a smear of toothpaste on their brush containing no less than 1,000 parts per million fluoride. And a good example is this toothbrush, which contains 1,000 parts per million fluoride. And basically only use a smear of the toothpaste on the brush. As soon as the teeth erupt, brush the kids' teeth, twice daily, once being at nighttime and one other time during the day. All children from ages 3 to 6 years old should use a pea-sized amount of the toothpaste on their brush. Should also brush twice a day, once at nighttime before bed and one other time during the day. The paste should contain between 1,350 and 1,500 parts per million fluoride, and a good example is this toothpaste, which contains 1,400 parts per million fluoride. This age group, so from 3 to 6 years old, it is also suggested to visit the dentist for a fluoride treatment, and that is fluoride varnish applied twice a year. And if you have children that are high in risk to develop caries or already have caries present, then it is suggested to visit the dentist 3 to 4 times a year for fluoride treatment and also take fluoride supplements. All other children and young adults are suggested to use a toothpaste containing no less than 1,350 parts per million fluoride. Brush twice daily at least, and spit out after brushing rather than swish and swash with water or rinse with water. And they are suggested to get a professional fluoride treatment at the dentist twice a year. If you would like to know any other advice regarding kids and their oral health, please check out my other video that I did linked up above. So for children from 7 and above, so children and young adults, if they are giving concern and they have caries present or a high risk at developing caries, we do all of the above mentioned, plus we do fluoride treatment 3 to 4 times a year. If the kid is 8 years plus, we prescribe a daily fluoride rinse. For those 10 years plus, we prescribe a special toothpaste with a lot more fluoride in it. For those children who are above 10 years and above 16 years, we prescribe toothpastes that are much higher in fluoride concentration. For all adults, in order to prevent caries, we have to use a toothpaste containing no less than 1,350 parts per million of fluoride. And this is Colgate Max White. It has 1,450 parts per million fluoride, and you can use this. You can also use Colgate Max Fresh. This has 1,450 parts per million as well. And you can also use, if you have sensitive teeth, you can use Sensodyne, and this Sensodyne multi-action has, let me see, this has 1450 as well, parts per million of fluoride. There are out there a variety of toothpaste. You just make sure that you go to the ingredient list and you find that there is more than 1350 parts per million fluoride. All adult patients giving concern, so with predisposed risks of high caries or with active caries, we still suggest to do professional fluoride treatment twice a year at the dental office. We also, if we have root caries or active root caries, we do prescribe higher concentrations of fluoride toothpaste. So make sure to speak to your dentist about these details. Do you know if you live in an area where there is fluoridated tap water? Please comment in the section below because I would really like to know, and maybe we can find out together. This is all for today's video. If you like my content and you like free advice without having to go to the dentist, then please check out my Brushing Your Teeth with Dr. Vesa series, which is a playlist linked on my channel, and feel free to share it with anyone that you like. Enjoy. Have a good one.